Here we go, 2-minute case of the day. So here we have a CT, an axial and coronal, and a patient that was done for abdominal pain, and the radiologist saw this asymmetric soft tissue prominence at the level of the pelvis, just adjacent to the uterus here and adjacent to the rectum, and obviously it's an asymmetric finding that we can see in both images. With the red arrow, that big enlarged lesion, which is actually the piriformis muscle, and on the left side we don't see anything but the neurovascular bundle going down. So the radiologist thought it was an enlarged piriformis syndrome, but it looked too big and asymmetric, so recommended to do an MRI. On the other MRI, we have T1 images without fat suppression and T1 images with fat suppression here on the left. And we see with red arrows that on the right side, that mass is actually the piriformis muscle that is really enlarged. It's causing mass effect, or it's pushing anteriorly the neurovascular bundle here of the sciatic nerve. But we see in the post-contrast images that there is no enhancement. So this is just the normal muscle that is just enlarged. The patient was asymptomatic, so we questioned the diagnosis of piriformis syndrome. And then we kept looking, and on the left side, it was not that the piriformis was normal or small, it was that it was non-existent. So this is a rare case of agenesis of the piriformis on the left side, but it did question the diagnosis of piriformis syndrome because of the optical illusion that this muscle is too enlarged, and it is enlarged. So piriformis syndrome is a poorly understood cause of hip pain, and usually is accompanied with burning sensation of the buttock and radiculopathy. Usually patients get worse when they are sitting for a long time, and they can be associated to anything that affects the muscle, like post-traumatic changes or inflammatory changes, myositis ossificans, or any other abnormality that can enlarge the muscle. Treatment is therapy. Some people inject steroids, and some other people may inject Botox to relax the muscle and have some positive results. So piriformis syndrome, look for asymmetric enlargement of the piriformis muscle in a patient that is symptomatic. Thank you.